This is recording, so I think I'm good. Okay, so I had penicillin or Pen-G. So penicillin is a beta-lactam antibiotic. So the MOA is that it is going to be targeting bacterial cells and destroying their cell wall. So it does that through two different actions. It's going to inhibit transpeptidase enzymes, and that synthesizes the cell wall. And then it's also going to activate autolysin, which opens up the cell wall. So doing those two things together is going to help destroy and ultimately kill that bacterial cell. So what does penicillin mainly target? It's mainly targeting infections that are caused by gram-positive bacteriococci and bacilli. It can fight off some gram-negative bacteria, but mainly it's targeting gram-positive infections. And infections that I'm talking about are things of like the nose, the throat, the skin, urinary tract, the lungs, and then some STI infections as well that are caused by gram-positive. ADR wise for penicillin is mainly or generally pretty safe. That's just because it doesn't affect human cells the same way it does bacteria cell walls. I guess the most common ADR that's seen with penicillin is that a lot of people have allergies to it. About 7% of the population does. And it could be a mild allergy like rashes, hives, itching, or it could be more severe like anaphylaxis. Other ADRs is that it could also cause GI discomfort and put you at risk for superinfections like C. diff and candidiasis. So safety actions wise for penicillin, you want to make sure to be monitoring for any of those GI discomforts, any of those ADRs that relate to superinfections. And if you're giving it IM or IV injection wise, you need to make sure that you're holding that patient after for at least 30 minutes just to monitor them for anaphylaxis. If they end up not having any anaphylaxis, you can let them go. And then patient education wise for penicillin, educating them about taking the oral drug with food to decrease their GI discomfort is important, making sure they know to take it at the start of the meal. And then also you can educate them about just what are super infections since they are at risk for those whenever they take penicillin.